Can't recall the cardiac cycle in exams? Here is a simple flowchart and 2 diagram trick you can revise in under 5 minutes. So let's start. Cardiac cycle, it is one complete heartbeat. First we will write about the definition. It is a sequence of electrical and mechanical events from one beat to the next. For a heart rate of 75 beats per minute, this duration is about 0.8 seconds. In this cardiac cycle, 3 phases are important: atrial systole, ventricular systole and ventricular diastole. You can remember this trick A, V and rest. On the right side, you have to draw this diagram of phasic changes in the atria and ventricle. This circular diagram shows the inner circle of 0.1 second of atrial systole and 0.7 second of atrial diastole. Now outer circle showing ventricular systole for 0.3 and ventricular diastole for 0.5. Let's see these phases in detail. It starts with the atrial systole of 0.1 second. Here, the atrial contraction pushes the final 25% of the blood during the last rapid filling phase. This phase is followed by atrial diastole of 0.7 second. During this phase, both the atria receives the venous blood. After this, we are having ventricular systole for 0.3 seconds and ventricular diastole for 0.5 seconds. Ventricular systole, during this, the ventricles start contracting. This phase is called as isovolumic contraction of 0.05 seconds. Now, due to the isovolumic contraction, the pressure in the ventricle increases more than the atrial pressure, and this closes the AV valves and it causes the first heart sound. As the AV valves are closed, semilunar valves are not yet open. Ventricles contract as a closed chamber, so this phase is called as isovolumic contraction. After this, as the ventricular pressure becomes more than the pressure in the aorta and the pulmonary artery, blood ejects out in the phase of ventricular ejection of 0.25 seconds. First phase is called as a rapid phase of 0.1 and it is followed by the slow phase of 0.15. Here, blood ejected out into the aorta and pulmonary artery. This phase is followed by the ventricular diastole. First is protodiastole. After this, the ventricles start relaxing. And as the ventricles start relaxing, the semilunar valve snaps shut, it produces second heart sound. This relaxation is followed by next phase that is called as isovolumic relaxation phase of 0.06 seconds. As the semilunar valves are closed and AV valves are not yet open, ventricle relaxes as a closed chamber. This phase is followed by the rapid passive filling phase of 0.11 seconds. As the pressure in the ventricles decreases than the atrial pressure, all the blood which is stored in the atria falls down due to the gravity in this phase of rapid passive filling phase. This phase is causes the third heart sound. After this, the pressure between the atria and ventricles slightly reduces and the flow also reduces. This phase is called as diastasis or reduced filling phase of 0.19 second. At the end of this phase, about 75% of the blood reaches the ventricles. And lastly, having last rapid filling phase of 0.1 second. Here the remaining 25% of the blood comes down from atria to the ventricles. And this phase is responsible for the fourth heart sound. In exams, just remember 2 diagrams are important: circular phase diagram and pressure volume graph you can see on the right side. You have to draw this diagram, it's very important. In this diagram you can see you will draw aortic pressure, then the ventricular pressure, atrial pressure, and down you will draw about the volume of the ventricles. To explain about the pressure changes summary, you will explain this under 3 headings. Ventricular pressure, here the pressure changes between 80 to 120, again comes back to 80 on left side, whereas right side maximum pressure attained is 25 mm of mercury. Then the atrial pressure changes in the form of JVP. Here you can see 3 positive waves: A wave, C wave and V wave. A for atrial systole, C for ventricular contraction and V for venous filling. And lastly, on the top, aortic pressure. This also deviates between 80 to 120 mm of mercury and it also produces dicrotic notch or incisura. And this is a quick revision box for volume of the blood. So at the end of the diastole, amount of blood remaining is 130 ml, that is end diastolic volume. When the ventricle contract, the stroke volume is about 80 ml ejected out, and this gives us 50 ml of blood remain behind, that is end systolic volume. At the end we get the ejection fraction, that is 65% of the end diastolic volume. And last account about the heart sounds. Here you have to remember the difference between the first and second heart sound. The cause of first is sudden closure of AV valves, second is closure of semilunar valves. Phases: first start at the ventricular systole, whereas second start at the ventricular diastole. Character of first is long, soft and low pitch, second short, loud and high pitch. Sound: first sound as a lub, second sound as a dub. And ECG: first occurs at the peak of R wave and second occurs at the end of T wave. With this we finish the answer, and lastly the applied aspect. There is the clinical implications of effect of tachycardia. So whenever heart rate increases, it produces 2 effects. First one on the coronary blood flow, because it occurs only during diastole, so less perfusion, so risk of myocardial ischemia. And second, again decrease in diastole causes ventricular filling pressure, ventricular filling time decrease, and this reduces cardiac output and heart failure symptoms. Remember, this line gives you extra edge over the others. So this is your final answer will contain. It contains the definition of the cardiac cycle, then about the circular diagram of phasic changes, then phases of the cardiac cycle in the form of flow chart, and lastly the pressure volume curves. And do not forget to write this applied aspect in the form of tachycardia. Now watch the full 10 marks answer video to learn exactly how to write this in your exam sheet. Thank you.